What tests are used to confirm active TB? When it comes to confirming active tuberculosis, or TB, healthcare providers relying on a mix of clinical evaluations and specific laboratory tests. The journey often starts with a thorough medical examination. During this exam, a doctor listens to the lungs using a stethoscope, checks for swollen lymph nodes, and assesses symptoms like a persistent cough, weight loss, night sweats, and fever. These signs can indicate the presence of active TB. Next, there are tuberculosis infection tests. These tests help determine if a person has been infected with TB bacteria but cannot confirm if the disease is active. One common test is the tuberculin skin test. In this test, a small amount of tuberculin is injected just under the skin. After 48 to 72 hours, the injection site is examined for swelling. A positive result suggests TB infection but does not clarify if it is latent or active. Another option is the interferon gamma releases assays. These blood tests, like quantiferon TB Gold Plus or T-spot TB, measure how the immune system responds to TB antigens. Similar to the skin test, a positive result indicates TB infection but not active disease. To confirm active TB disease, especially in the lungs, direct detection of the bacteria is crucial. One method is sputum smear microscopy for acid-fast bacilli. In this test, patients provide sputum samples, usually 3, which are stained and examined under a microscope for TB bacteria. While this test is quick, it can yield false negatives or positives and cannot definitively confirm active TB on its own. The gold standard for confirming active TB is the mycobacterial culture. In this process, sputum or other clinical specimens are cultured to grow Mycobacterium tuberculosis. Although this method is highly accurate, it takes several weeks to get results. Another advanced option is nucleic acid amplification tests. These molecular tests quickly detect TB bacterial DNA or RNA in sputum samples, providing high sensitivity and specificity for confirming active TB. If TB is suspected outside the lungs, known as extrapulmonary TB, samples from affected sites, like lymph nodes or cerebrospinal fluid, are collected for culture, microscopy, and molecular testing. Imaging tests, such as chest X-rays, also play a role. They help identify lung abnormalities that may suggest active TB but cannot confirm the diagnosis on their own. Instead, they are used alongside microbiological tests to provide a clearer picture. In summary, confirming active TB involves demonstrating the presence of Mycobacterium tuberculosis through sputum smear microscopy, culture, or molecular tests, combined with clinical assessment and imaging. Tests that detect immune response, like the skin test or interferon gamma releases assays, indicate TB infection but cannot confirm active disease alone. This comprehensive approach aligns with current medical guidelines, ensuring accurate identification of active TB for appropriate treatment. Always remember to consult healthcare professionals for personalized advice and guidance.